Hi all, this is your Dr. Mommy. In today's video, we'll be talking about the HPV vaccine Gardasil and Gardasil 9. So what is this HPV? HPV stands for human papilloma virus. Basically, it causes cervical cancer in females. So it is actually caused by two main variants, that is 16 and 18, whereas precancerous conditions are caused by many other variants of this human papilloma virus. Now, when it comes to cervical cancer, how does a lady present with, or how does she come to me? So, she comes to me with abnormal uterine bleeding, wherein there can be intermenstrual bleeding, that is in between cycles she can have menses, or post sexual intercourse she might have some bleeding. And foul smelling vaginal discharge can be there, like the vaginal discharge which comes out normally. So it will be foul smelling. So in that case, you will have to consult the nearest gynecologist to rule out cervical cancer. And sometimes in the later stages, she can present with low backache. So this is in the later stages. The last symptom could be postmenopausal bleeding. Say a lady attains her menopause. 1 year after attaining menopause, she complains of bleeding, then we will have to have a suspicion towards the cervical cancer. In fact, there can be many other causes, but cervical cancer also has to be ruled out. Now, let's know the mode of transmission. It is transmitted through oral and vaginal route, basically through sexual intercourse. So, how do we know if the lady has got cervical cancer or not? Basically, we screen all the females who are in their reproductive age group by doing a pap smear. So once in 3 years we recommend a pap smear to be done, so that this will rule out the cervical cancer, or one of the mode of screening for cervical cancer is pap smear test. Now, can we prevent the cervical cancer? Yes, there is vaccination for the cervical cancer. These are the two cervical cancer vaccines. Basically, it is called Gardasil and Gardasil 9. Gardasil has got 4 variants, that is 4 types, 6, 11, 16 and 18. So, 16 and 18 are the most common variants which cause the cervical cancer, whereas 6 and 11 cause the precancerous conditions. Gardasil 9 covers 9 variants, which include the most common causative agents like 16 and 18 types, and also all other precancerous variants. This gives a better efficacy when compared to Gardasil, because Gardasil is a quadrivalent, that is, it has got only 4 types, whereas Gardasil 9 covers all the 9 variants of this HPV virus. Now, who all can take this Gardasil vaccine and when to take and dosage? So, from the age 9 years, when a child attains 9 years till the postmenopausal age group, a lady can take this Gardasil vaccine. So, if the child is between 9 to 14 years of age, we recommend 2 doses, that is 0 and 6 months apart. Whereas, if the child is above 14, that is 15 years to 45 years of age group, a female has to take 3 doses, that is 0, 1 and 6. That is 0 is today's and 1 month apart and 6 months apart from the first dose. So, this is how we recommend. I suggest all my patients who are in this age group of 9 to 45 years to take this Gardasil vaccine and get rid of this cervical cancer. Thank you. I hope you like this video. Please like, share and subscribe to my YouTube channel, Dr. Mommy's Happy Home. See you all. Bye-bye.